Hi, I'm Olivia. I'm here to give you some quick tips on how to use the Kesimpta Sensoready Pen. Someone from your healthcare team will give you guidance on how to take Kesimpta the first time you use it. After that, you can take it on your own. Watching this video is a great supplement to those instructions. There are no pre-medications required to take Kesimpta. When you start, you'll give yourself just 1 dose per week for 3 weeks. Then skip a week. Take your first monthly maintenance dose on the 5th week. After that, you take it once a month, all in the comfort of your own home. Here's a quick tip. Try to take Kesimpta on the same date every month. For example, if your first monthly dose is on April 15th, then take your next dose on May 15th. If this is your first time using the Sensoready Pen, it's natural to be a little nervous. But the Sensoready Pen has built-in features designed to help you do it right. You'll get a quick tips for use brochure to use as a reference, or you can download it from the resources page at the Kesimpta website. Once you're ready to inject, you'll be done in no time. Okay, now we're ready to get started. Remember to keep your Kesimpta box in the fridge. Take it out 15 to 30 minutes before you use it. Let it come to room temperature. This will make the injection more comfortable. Then grab an alcohol wipe and a cotton ball. Choose an injection site. The front of the thigh is recommended. You can also use the lower stomach area except 2 inches around your belly button. If someone is helping you, they can inject into your outer upper arm. Do not inject into areas where the skin is tender, bruised, red, scaly, or hard. Avoid areas with moles, scars, or stretch marks. Next, wash your hands thoroughly. Then clean the site with an alcohol wipe and let it dry completely before injecting to avoid stinging. When it's time, take the pen out of the box. Don't use if the liquid has visible particles, is cloudy, or if the pen has expired. And remember not to shake it. Remove the cap and throw it away. Don't try to reattach it. You'll see there's no visible needle. And be sure to use the pen within 5 minutes of taking the cap off. Now to demonstrate the injection, I'm going to be using a Kesimpta Sensoready training pen without a needle or actual medication. If you want to practice, you can get your own training pen. You'll want to hold the pen at a 90-degree angle to your cleaned injection site. That's just straight up and down. Press down and hold firmly against your skin to activate the injection. You'll feel the needle and hear the first click. The green indicator will start moving. Keep holding and watch the green indicator fill the window. You'll know you're almost done when you hear the second click. There it is. This usually takes several seconds. Once the green indicator is full and has stopped moving, you'll know that you've done it right. Then you can remove the pen. If there's blood at the injection site, just press down with a cotton ball, but don't rub. What's nice about the Sensoready Pen is when you hear the 2 clicks and you see the green indicator fill the window, you can be confident that the injection was complete. You may be worried about injection site reactions, especially if you've done injections before. In trials of Kesimpta, injection site reactions were mild to moderate, such as redness, swelling, pain, or itching at the injection site. These mainly happened within 24 hours of the first dose, but can happen with later injections. Other reactions may include fever, headache, pain in the muscles, chills, and tiredness. You can find more information about this on the Understanding Side Effects page on the Kesimpta website. Of course, everyone reacts to medication differently, so you should call your doctor if you have any concerns. After each injection, be sure to dispose of your used pen in an FDA-cleared Sharps disposal container. Remember not to throw it in the household trash. If you have questions about disposal, visit the FDA website. So to recap, get the injection site ready. Press firmly, hold, and listen for the first click. The second click means the injection is almost complete. Then make sure the green indicator has filled the window and stopped moving. And your injection is done. Okay? That's it for now. Thanks for watching.
Indication. What is Kesimpta, ofatumumab injection? Kesimpta is a prescription medicine used to treat adults with relapsing forms of multiple sclerosis, MS, including clinically isolated syndrome, CIS, relapsing remitting disease, and active secondary progressive disease. It is not known if Kesimpta is safe or effective in children. Important safety information. Who should not take Kesimpta? Do not take Kesimpta if you have an active hepatitis B virus, HBV infection, have had an allergic reaction to ofatumumab or life-threatening injection-related reaction to Kesimpta, What is the most important information I should know about Kesimpta? Kesimpta can cause serious side effects, such as infections. Serious infections, which can be life-threatening or cause death, can happen during treatment with Kesimpta. If you have an active infection, your healthcare provider, HCP, should delay your treatment with Kesimpta until your infection is gone. Kesimpta taken before or after other medicines that weaken the immune system may increase your risk of getting infections. Tell your HCP right away if you have any infections or get any symptoms, including painful and frequent urination, nasal congestion, runny nose, sore throat, fever, chills, cough, or body aches. HBV reactivation. If you have ever had HBV infection, it may become active again during or after treatment with Kesimpta, reactivation. If this happens, it may cause serious liver problems, including liver failure or death. Before starting Kesimpta, your HCP will do a blood test to check for HBV. They will also continue to monitor you during and after treatment with Kesimpta for HBV. Tell your HCP right away if you get worsening tiredness or yellowing of your skin or the white part of your eyes. Progressive multifocal leukoencephalopathy, PML. PML may happen with Kesimpta. PML is a rare, serious brain infection caused by a virus that may get worse over days or weeks. PML can result in death or severe disability. Tell your HCP right away if you have any new or worsening neurologic signs or symptoms. These may include weakness on one side of your body, loss of coordination in arms and legs, vision problems, changes in thinking and memory, which may lead to confusion and personality changes. Weakened immune system. Kesimpta taken before or after other medicines that weaken the immune system could increase your risk of getting infections. Before you take Kesimpta, tell your HCP about all your medical conditions, including if you have or think you have an infection, including HBV or PML. Have ever taken, currently take, or plan to take medicines that affect your immune system. These medicines could increase your risk of getting an infection. Have a history of liver problems. Have had a recent vaccination or are scheduled to receive any vaccinations. You should receive any required live or live attenuated vaccines at least 4 weeks before you start treatment with Kesimpta. You should not receive live or live attenuated vaccines while you are being treated with Kesimpta and until your HCP tells you that your immune system is no longer weakened. Whenever possible, you should receive any non-live vaccines at least 2 weeks before you start treatment with Kesimpta. Talk to your HCP about vaccinations for your baby if you used Kesimpta during your pregnancy. Are pregnant, think that you might be pregnant, or plan to become pregnant. It is not known if Kesimpta will harm your unborn baby. Females who can become pregnant should use birth control, contraception, during treatment with Kesimpta and for 6 months after your last treatment. Talk with your HCP about what birth control method is right for you during this time. Are breastfeeding or plan to breastfeed. It is not known if Kesimpta passes into your breast milk. Talk to your HCP about the best way to feed your baby if you take Kesimpta. Tell your HCP about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use Kesimpta? See the detailed instructions for use that comes with Kesimpta for information about how to prepare and inject a dose of Kesimpta and how to properly throw away, dispose of, used Kesimpta Sensoready pens or pre-filled syringes. Use Kesimpta exactly as your HCP tells you to use it. Your HCP will show you how to prepare and inject Kesimpta the right way before you use it for the first time. Do not inject into areas where the skin is tender, bruised, red, scaly, or hard. Avoid areas with moles, scars, or stretch marks. Kesimpta may cause serious side effects including injection-related reactions. Injection-related reactions are a common side effect of Kesimpta. Injecting Kesimpta can cause injection-related reactions that can happen within 24 hours, 1 day following the first injections and with later injections. There are 2 kinds of reactions. At or near the injection site, redness of the skin, swelling, itching, and pain. Talk to your HCP if you have any of these signs and symptoms. That may happen when certain substances are released in your body. Fever, headache, pain in the muscles, chills, tiredness, rash, hives, trouble breathing, swelling of the face, eyelids, lips, mouth, tongue and throat, and feeling faint or chest tightness. Contact your HCP right away if you experience any of these signs and symptoms. especially if they become worse or you have new severe signs of reactions after subsequent injections. It could be a sign of an allergic reaction, which can be serious. Low immunoglobulins. Kesimpta may cause a decrease in some types of antibodies. Your HCP will do blood tests to check your blood immunoglobulin levels. Liver damage. Kesimpta may cause liver damage. Your HCP will do blood tests to check your liver before you start Kesimpta and while you take Kesimpta if needed. Tell your HCP right away if you have any symptoms of liver damage, such as yellowing of the skin and eyes, jaundice, nausea, vomiting, unusual darkening of the urine, feeling tired or weak. The most common side effects of Kesimpta include upper respiratory tract infection with symptoms such as sore throat and runny nose and headache. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide, on this site or at www.kesimpta.com.